Good afternoon and welcome to another episode of CIOtv. I'm Jennifer Hopper, Chief Strategy Officer for AuditMax, and I'm joined with Michael McGill from the Medical Service Company. Michael, welcome.
Hi, Jennifer. Thanks for having me today. I look forward to talking with you.
Yeah, absolutely. So just to get started, if you would introduce yourself and a little information about Medical Service Company.
Yeah, my name is Michael McGill. I'm Chief Information Officer for Medical Service Company. So we are a provider of home medical equipment and clinical services. So as patients discharge from hospitals and other acute care scenarios and they go to their home, we provide the home medical equipment and clinical services to help them manage their disease state in the home. Headquartered in Cleveland, Ohio, but we have 40 locations throughout the Midwest.
Oh, wow. So you are a lifeline for a lot of people as they come out of after surgeries and hospital visits.
Yeah, definitely.
Wow. And I'm sure with HIPAA, that's a very big part of your position as well.
Yeah, security is a very high priority for us. You know, we have an obligation to our patients to protect their information. And obviously we have HIPAA guidelines that we have to follow in order to make sure that we are doing everything to protect protect our patients' information.
Awesome. As a patient of, just as a patient, I think we all appreciate that because we know how important that information is and how, a lot of people just keep it very close to them and don't want information leaked. So it's definitely something that bothers a lot of people and keeps them on the forefront knowing that, that could happen. So a big part of the world right now for sure. So what is your background? How did you get into IT and especially in the medical field as well?
Yeah, Jennifer. I think my journey into IT was like a very happy kind of accident. I guess I always kind of enjoyed tech and working with things growing up, but I kind of just found my way into tech. I was going to school and I was looking through the list of majors, and this would have been probably around 1995. But I was looking down the list of majors and I saw computer science, and I remember thinking, computers seem the way of the future. So I went ahead and majored in computer science. And again, I kind of think of it as one of the most fortunate kind of happy accidents, if you will, that happened to me, because it's just been such a great career, and I was just fortunate to find my way into something that I ended up really loving. And when I got my first job in tech, it was in healthcare, and I've just been in health IT through my entire career. So it's been a great ride and still a lot of ride left, but really enjoy working in health IT, the mission, what we do as an organization, caring for our patients. It's incredible and very rewarding.
So you had a Bob Ross moment there getting into IT.
A little bit, yeah.
Yeah, it can be a little daunting when you're in college, but I think you definitely picked a good major that gave you a lot of upward movement for your entire career.
Yeah, definitely. Again, it's something, you go into college and you're trying to find something that you can get a job and start building a career. And, tech is really, over time, it turns from a job into a career, into a mission. And, kind of just my career, my life is just so kind of tech is so interwoven in it. Again, just a very rewarding career that I almost think of really as a mission anymore of also trying to help other people, get into tech. So yeah, it's been, again, a great ride.
I completely understand. We're a big part of the STEM 2 hub here for our area, and then we've also done some consulting with other STEM 2 hubs in the nation. So we feel the pinch of not having enough and giving kids the opportunity to see that there is opportunity out there. And in a lot of cases, it doesn't involve a big education. There's so much on-the-job training, and it's constantly evolving. Right. So a textbook is out of date before it's even printed at this point.
Yeah, that's the beautiful thing about tech. I mean, you go all the way from, you can get a master's degree in computer science and get into something like data science or application development, or you can go a certification or self-taught route and get into the infrastructure end of things. I mean, even now with development, you can do boot camp, do self-taught, but there's so many different paths to getting into tech. And fortunately, on my IT team, on my tech team, I get to welcome new people into tech. A lot of times, like maybe through help desk positions, and I tell them, you have taken the first step, through the doorway into a career in tech, and there's just so much opportunity for you in tech. I love seeing people break into tech and starting their careers, because again, just so much opportunity if they're just willing to always be learning, continue to work on themselves. Just a ton of opportunity out there for a rewarding career.
Absolutely. A lifetime of opportunity, to say the very least. Real quick before we wrap up, I wanted to ask you, what do you see in the next 2 to 3 years as far as changing in IT, and what's really, I know cybersecurity is a big part of everything right now and everyone's talking about it, but where do you see things going in the next couple of years and the big challenges that you're going to be faced?
Yeah, I mean, to me, the biggest real world challenge that we face as an organization is staffing to support our growth. We're in growth mode as an organization, and we're acquiring, and we want to grow, and we want to care for more patients, and expand our footprint and grow our census. And right now, the biggest bottleneck to that is available staffing, both attraction and retention. So in order for us to be able to scale at the level we want to, really, RPA, automation is where I'm at right now. I have kind of a little mantra for our team this year, AATT, automate all the tasks. In order for us to scale the way we want to, we need to automate. We need to put the humans into doing the value add patient interactions, the important things that only humans can do, and let automation take care of the busy work and the tasks. We don't want our people, our most valuable resource, just going in and going down and doing repetitive tasks. We want automation. So we're diving into RPA, using APIs to just kind of make business decisions based on data, move orders along through the process. So again, we're trying to automate whatever we can automate so that we can continue to grow, and our most valuable asset, our people, can care for patients and do the valuable things that only human beings can do.
Absolutely, I understand. In a lot of cases, the things that do get automated are the jobs that no one really wants to do anyway. They're the kind of the monotonous, mundane work day in and day out. So we've done a lot, made a lot of investments with our company through ServiceNow and other platforms to automate as well. So I completely understand, but we could definitely talk about this all afternoon, and hopefully we'll have a follow-up, but I just wanted to thank you for being on the show today.
Yeah, thanks for having me, Jennifer.
All right, thanks so much, and I look forward to talking with you again. And thank you everyone for joining us today, and that's a wrap for CIOtv. We'll see you again next time.